Hello, I'm Dr. Sandra Freyhofer, practicing general internist and liaison to ACIP, the Advisory Committee on Immunization Practices. Welcome to ACP's 2021 Adult Immunization video series. The topic, racial and ethnic disparities in adult immunization, and why leveling the playing field is so important. Fact: adults risk significant illness, hospitalization, disability, and even death from vaccine-preventable diseases, particularly influenza and pneumococcal disease, and now COVID-19. Our source, CDC's NHIS, the National Health Interview Survey. CDC has done these surveys for years, since 1957. The content and methodology is updated every decade or so, most recently in January 2019. Please understand, these are historical snapshots, but if you check the graphic representation of adult immunization trends over the last decade, one fact shouts out. The graph is flat. We don't make much headway. We don't really get better at getting adults immunized. And that means millions of Americans suffer the consequences. The trends are even worse for minority patients. Racial and ethnic differences in vaccination coverage persist for all vaccinations, with lower coverage for most vaccinations among non-white compared to white adults. Themes from recent focus group discussions about COVID vaccines shed light on why. Discussions with frontline workers and traditionally underrepresented groups included concerns about the process, distrust of government, distrust of the healthcare system, concerns that politics and economics will be prioritized over science, fear based on past experiences, and fear the vaccine will not work for them or their community. It's likely these concerns not only apply to COVID vaccines, but to all vaccines in general. It's high time this issue gets the attention it needs and deserves. A recent Politico article points out that for decades, communities of color have been underrepresented in clinical trials. Gary Puckrin, head of the National Minority Quality Forum, says ensuring equal representation in clinical trials is important to gaining trust among minority communities. Both Pfizer and Moderna attempted to do just that, and their respective 45,000 and 30,000 participants in phase 3 trials of their mRNA COVID vaccines. For example, African Americans are nearly 4 times more likely to be hospitalized for COVID compared to white Americans, and nearly 3 times more likely to die from it. Yet a December 3, 2020 Pew Research study found that only 42% of African Americans say they intend to get COVID vaccine, compared to 63% of Hispanic and 61% of white adults. On the other hand, English-speaking Asian Americans are much more supportive of vaccination. 83% say they would definitely or probably get vaccinated. Granted, that was on December 3rd, before a vaccine was approved and available, but this snapshot shows we have much work to do for COVID and other vaccines. The Ames Method, announce, inquire, mirror, secure, is a helpful platform for initiating healthy conversations about vaccination. At the same time, it can instill vaccine confidence. A, for announce that your patient is due for a vaccine and you will vaccinate today. Assume vaccination will occur, that it will happen. If it doesn't, I, for inquire, so you can understand their concern and get a feel for their level of vaccine hesitancy. Listen, don't interrupt, let them finish. Next, M, for mirror. Make the person feel heard. Make sure they know you've listened and you understand by repeating what they said. Then you respond to their concerns in a way that S, secures trust. They will either agree to be vaccinated then, or at a certain time, or that trust will keep the door open and enable another opportunity for discussion. The way you respond is important. Try not to trigger new concerns in the process, like don't repeat a myth to debunk it. CDC says we should routinely address adult vaccination status at every clinical encounter and either administer needed vaccines or refer patients to someone or some place that can administer them. Standing orders can help. That way your entire patient team can help make vaccination happen. We also need to think out of the syringe about local creative ways of setting up vaccination settings that best suit the communities that need them. Morehouse School of Medicine is working with the Federal Office of Minority Health on these types of initiatives. Always remember, physician recommendation is one of the most effective motivators of successful vaccination. Begin one patient at a time and practice what you preach. For the American College of Physicians, I'm Dr. Sandra Freyhofer.